Rhodiola is a herb that grows in the cold mountainous regions of Europe and Asia. Its roots are considered adaptogens, meaning that they help your body adapt to stress when they're consumed. Rhodiola is also known as Arctic root or golden root. Its scientific name is Rhodiola rosea. Its root contains more than 140 active ingredients, with two most potent being rosavin and salidroside. People in Russia and Scandinavian countries have used rhodiola for centuries to treat anxiety, fatigue, and depression. Rhodiola has long been used as an adaptogen, a natural substance that increases your body's resistance to stress in non-specific ways. Consuming adaptogens during stressful times is thought to help you handle stressful situations better. Rhodiola has also been shown to improve symptoms of burnout, which can occur with chronic stress. One study involved 118 people with stress-related burnout who took 400 milligrams of rhodiola daily for 12 weeks. Study participants showed clear improvements in various symptoms such as stress and depression, which are commonly associated with burnout. The most improvement occurred during the first weeks and continued throughout the study. Researchers noted that this was the first trial investigating the clinical outcomes of rhodiola treatment for burnout, and they found the results encouraging and recommended further trials. Stress, anxiety, and inadequate sleep are just a few factors that can contribute to fatigue, which can cause feelings of physical and mental tiredness. Due to its adaptogenic properties, rhodiola is thought to help alleviate fatigue. In one study, 100 people with chronic fatigue symptoms received 400 milligrams of rhodiola every day for 8 weeks. They experienced significant improvements in stress symptoms, fatigue, quality of life, mood, and concentration. These improvements were observed after only 1 week of treatment and continued to improve throughout the final weeks of the study. Depression is a common but serious illness that negatively affects how you feel and act. It's thought to occur when chemicals in your brain, called neurotransmitters, become unbalanced. Health professionals commonly prescribe antidepressants to correct these chemical imbalances. It's been suggested that rhodiola may have antidepressant properties that helps to balance the neurotransmitters in your brain. One study compared the effects of rhodiola with the commonly prescribed antidepressant sertraline, which is sold under the name Zoloft. In the study, 57 people diagnosed with depression were randomly assigned to receive rhodiola, sertraline, or placebo for 12 weeks. While rhodiola and sertraline both reduced the symptoms of depression, sertraline had a greater effect, but rhodiola produced fewer side effects and was better tolerated. A review of 36 animal studies concluded that rhodiola may improve learning and memory function. In another study involving nursing students, rhodiola decreased both mental and physical fatigue after 42 days. The students took 364 milligrams daily of either rhodiola or a placebo at the start of their waking period, followed by one additional capsule within the following 4 hours. An animal study found that just a single dose of rhodiola increased memory and had an antidepressant effect on mice. It suggested that rhodiola could become a good tool to increase cognition and to counteract mood disorders in people. Another research review concluded that the therapeutic properties of rhodiola may benefit many age-related diseases. Researchers called for more research to bridge the gap between experimental results and clinical applications. Rhodiola has been claimed to improve sports performance by reducing physical and mental fatigue and increasing antioxidant activity. However, research results are mixed. On the positive side, one animal study found that rhodiola could improve muscle power and strength performance in rats. In the study, the rats were given Rhodiola rosea extract combined with another compound in rhodiola called Raponticum carthomides after the resistance exercise. Another study found that ingesting rhodiola shortened reaction time and total response time in young, healthy, physically active men. It also increased antioxidant activity, but had no effect on overall endurance. In other studies, rhodiola has been shown to improve exercise performance by decreasing perceived exertion, or how hard participants felt their bodies were working. On the skeptical side, research points to studies showing that rhodiola supplementation did not change oxygen uptake or muscle performance, and it did not enhance the immune system of the marathon athletes. Diabetes is a condition that occurs when your body develops a reduced ability to produce or respond to the hormone insulin, resulting in high blood sugar. People with diabetes commonly use insulin injections or medications that increase insulin sensitivity to better manage their blood sugar levels. Interestingly, animal research suggests that rhodiola may help to improve diabetes management. The salidroside compound in rhodiola has been shown to help protect against diabetes and diabetic neuropathy. These studies were performed in rats, so their results can't be generalized to humans. However, there's a compelling reason to investigate the effects of rhodiola on diabetic people. Salidroside, a component of rhodiola, has been investigated for its anti-cancer properties. Test tube and animal studies have shown that it may inhibit the growth of lung, bladder, gastric, and colon cancer cells. As a result, researchers have suggested that rhodiola may be useful in the treatment of many types of cancer. It's best to take rhodiola on an empty stomach, but not before bedtime, as it has a slightly stimulating effect. Most people take rhodiola extract in capsules or tablets containing between 1 to 200 milligrams with a 3% rosavin and a 1% salidroside content. Liquid tinctures are also available. According to current research findings, rhodiola may be effective for improving symptoms of stress, fatigue, or depression when taken in doses ranging from 400 to 600 milligrams per day in a single or divided doses. What's more, some studies have shown that lower doses between 200 and 300 milligrams per day may help to boost athletic performance.